Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and Crystal. So today we're going to be discussing hyperpigmentation, the ways that we prevent it and treat it. This is piggybacking on our last discussion on the causes of hyperpigmentation and how to identify them. So let's dive right in. So Heather, what can we do to prevent hyperpigmentation?
Sunscreen. I think sunscreen is the biggest thing that you can do to help protect your skin. The higher the sunscreen, the better. I mean, you do want something SPF 30 or higher, but to kind of give you an idea, so like a mineral-based sunscreen that's SPF 30, 97% of the UV rays are being blocked by that sunscreen. Whereas if you're using SPF 50, 99% of those UV rays are being blocked. So it does make a difference. The higher, the better.
Yeah. And what about the thought that, since you're blocking 99% with SPF 50, does it really matter to go to a higher SPF?
Higher than 50?
SPF 50.
I don't know.
How much does it block with 100?
That I don't know.
So the interesting thing is that we have found in studies that people do not apply enough of the sunscreen to get the actual SPF protection. Like if people actually applied it the way that they're supposed to properly, you do get that, SPF protection.
And reapply.
But people are not doing that. So that's why I do think it's helpful to have a higher SPF. You have more of that physical barrier from that zinc oxide. But, because in real life application, people are not applying enough of it. So maybe you are applying an SPF 100, you're still applying it pretty poorly.
Yeah.
But you're still getting a little bit more protection than applying a poorly, than using a poorly applied like SPF 50.
Yeah.
I read somewhere that they recommended a shot glass
for the body.
For the body.
I think finger lengths for the face.
Yep.
No, I'm like a liquor bottle. Like I feel I'm like white. Like I am like covered.
Well, that one time we did IPL and I started putting sunscreen on and you were like, why are you putting so much on? And I'm like, this is not much you need.
Come on. You're a liar. What about the people that will put all this sunscreen on and they immediately like jump in the pool?
Oh, yeah.
So you do have to watch out for that.
Especially chemical sunscreens because they take like 15 minutes to start working.
Yeah, that's right. So with physical sunscreens, those that contain zinc or titanium, they're immediately active. It's the chemical ones that you have to put on at least 15 minutes before for optimal, prevention.
I think sun protective clothing is definitely the way to go.
I love it.
It's so easy. You don't have to reapply. It's protective. I mean, you have your SPF shirts. You can get hats, all different kinds of garments. They make cute little like cover-ups now. I mean, they have everything. So I feel like the SPF clothing is much more easy to abide to.
I've been meaning to research this, but does anybody know if the UPF degrades with the number of washes that you wash that piece of clothing?
I've heard that it retains its integrity over a long number of washes. Okay. So that's a good question. But yeah, I heard that they're pretty robust, especially the higher quality UPF clothing.
Yeah.
So yeah, I think those are definitely the top. You should be doing that every day. There are some supplements too that I think also are extremely helpful. So you might have heard of Heliocare, which is the polypodium
glucotamine.
Wait, I always forget the. I always just want to jump into the nucleus. But these are actually supplements you can take. It's derived from a fern, so it is vegan, organic. But they basically help prevent, so you use them in conjunction with sunscreen, but you can take these daily. Some people just take them when they know they're out at the beach or the pool or whatever, but it actually helps to kind of block that sun damage from occurring. And the studies on it are really interesting, and it shows really how effective it is. So anyone that has any like photosensitivity or, talking about this hyperpigmentation, I think it's extremely beneficial.
Yeah, I actually put most of my hyperpigmentation patients, especially my melasma patients, on the supplement as part of their protocol. I do think that it adds additional protection, and there aren't any real side effects with it. There's really no harm to it. So I've been pretty impressed with the results, and patients do notice a difference.
Mhm.
So it's a pretty cool supplement.
Yeah, my patient came back. I had put her on it like last month, and she was like, "I went to the beach and I didn't burn. Like,
Oh
I'm
my
so
God, what a
surprised.
concept.
Didn't be burning."
They can also pair it too with niacinamide, which is
Mhm.
a natural skin protectant too. It's not going to replace sunscreen by any means, but
Yeah.
Yeah, I think both of that, being said, sometimes I do worry about like specifically like my melasma patients. I used to see this one woman at my previous practice who would come in for her appointments with a huge sun hat. She'd be wearing gloves. She had like this is before COVID, like she'd have a mask on. I mean, she was like
Mm.
really covered up because she did not want to risk it. And at some point I'm like, I want you to go live your life. Like, I don't want you to be scared of the sun. I don't want you to like live in this like
too.
draping for your whole life. So it is kind of that delicate balance of like doing the best that you can, but also like being able to have fun and like do things too.
have
Well,
you
there-
seen? Oh, go ahead.
Yeah, there's people that think that they don't need to put anything on because there's a lot of patients that I've
Mhm.
seen or come across where they come in and they're just like, oh no, I don't need any sunscreen. I don't go anywhere.
Yeah.
But
I work from home.
What are your thoughts on the UV visors? Have you guys seen those where you like pull them
Mhm.
down on your
They're
face?
really big in Asia.
They are.
Yeah.
Yeah.
I think they're
like
kinda
a
cool.
beekeeper.
Yeah.
Yeah. Kind of.
Yeah. Oh, they're
It
wild.
looks like a hat, but it comes all the way down and blocks your
It's
entire
intense.
face. Yeah.
Oh wow.
They're kind of cool though.
Yeah.
Some of them are like reflective and they kind of look shiny.
Yeah.
We're going to get one for Dr. Zain for his birthday.
Yeah. And I'm going to brand it with my.
It needs to be gold.
Yeah.
It needs
Black
to
and
reflect gold.
Yeah, I think they're all I definitely get the motion behind it, but I don't know, at some point it's like, can you breathe in that? Like, like
Oh, yeah.
Yeah,
It's like
they're not
open.
that open.
it's like mesh kind of, right? Yeah.
No, I think that's like it's like
It looks like a reflective like
visor.
visor.
yeah.
I feel like I'd get so hot.
Yeah, like what about your like hot breath? Like your hair? Like does it like get
Isn't it
I don't know,
like
like
your-
foggy?
I think we're gonna have to do an experiment. We're gonna have to buy one and
Yes.
we're gonna have to try it out. And then we'll
Spend
videotape
a whole
our
day.
experience. I'm gonna walk around my office, see my patients open up. So yeah, sun protection is huge, and we're big proponents of that in our office. What about for our melasma patients who are on hormonal therapy like birth control or HRT? What can we do to help those patients? I mean, a lot of them are on them for, medical reasons.
Yeah, I think some of the treatments that we'll get into, especially like the oral ones, like I'll just mention tranexamic acid, I think works really well. But I think just knowing that sometimes those hormonal components do play a role, and especially like if you're planning on getting off of birth control soon, it could flare because your body is used to that exogenous or that kind of outside hormone being used. So I think prepping the patient too is very important.
hmm And then combination therapy, we're going to get into that. Topicals, orals, and even devices and lasers. So those can kind of help those tricky patients who are on these medications for medical indications and that can't necessarily come off of them. And unfortunately, they're kind of in a bind because a lot of what we want to offer is just not compatible with their other medical therapy.
A lot of times they don't know. They just think there's like just a one and done type of treatment and they need more than that.
Yeah, melasma is very tricky.
I think too, especially because the pigment is deep within the skin, it's going to take time for that to kind of be resurfaced, I guess.
Yeah, and it may require long-term therapy. It's not like, oh, we got to clear and then it's done.
Mm-hmm.
Oftentimes it requires months and months of therapy, and it may even be years. So it's just very case by case. Every patient's different. So that's why partnering with, your dermatologist and their team is very helpful.
Yeah. And seeing someone that knows, about the different conditions, I think to the untrained eye, pigmentation just looks like
Hmm.
pigmentation. So it's important to kind of have someone that knows what specific type of pigmentation you're dealing with and then what the best way to treat that is because, as we'll go into with some of the energy-based devices,
Mhm.
there are some forms of hyperpigmentation that, yes, are safe to use a laser on, but then there are some like melasma that, okay, now
Mhm.
you have to be more careful about what you're using. So being able to differentiate is really important.
All right, so let's dive into the different types of treatments for melasma and other forms of hyperpigmentation. So I always like starting off with conservative therapy, so the topical. So what are some of our favorite topicals to kind of use for these hyperpigmentation patients?
Hydroquinone is probably the gold standard.
HQ.
Yes, HQ for short.
And how
Hydro
does it work?
So it's actually like a bleaching agent. It targets that excess pigment. Like we kind of mentioned previously, it's not something that you want to do forever. You do have to take a break from it. And the nice thing though is while you're taking a break from hydroquinone, there are other things that you can do during that time, or you can even do things in conjunction with hydroquinone. So there are other kind of brightening agents that we use topically. So there's ascorbic acid or vitamin C, there's kojic acid, arbutin, licorice root extract, lactic acid, a lot of different things. And I
Mhm.
think they all work very differently. So doing a mix of these can really be beneficial.
Yeah. It's interesting. A lot of these different molecules inhibit the pigment production pathway by blocking some of the key enzymes, tyrosinase being one of them. So, like HQ, for instance, blocks that. It blocks the precursors from turning into melanin, which is needed for that pigment. So, and path, there's different steps of that pathway that different molecules kind of interact with. So that's why combination therapy is sometimes very helpful because it's kind of hitting that pathway in multiple ways.
Yeah, going back to vitamin C too, I think it really depends on what vitamin C you're using
Hmm.
because vitamin C is very unstable. So depending on what product you're using, if it's got like a clear glass bottle, if it's getting sun exposure to that liquid or that vitamin C serum, you can degrade or oxidize that vitamin C very quickly. So you want to use something ideally that's in like an airless pump or
Hmm.
something that is a little bit more shelf stable, but a lot of the more stable ones could be irritating. So
Yeah.
um, there's, I think, at least 3 types of vitamin C,
Hmm.
and each has their pros and cons.
I mean, for the aestheticians here, what are your thoughts on, the quality of the vitamin C serum, and are you paying for what you get for?
Oh, absolutely. Yeah. I think, going off what Heather said, there are a lot of vitamin C's that are unstable. I mean, even, you know, not to eat on specific brands, but there are some that you can even see the color change, like while you're using it. You
Yeah.
get it, and maybe it's that kind of clearish liquid. A month down the road, it's turning into that orange coloration. So I think even, with that being said, my favorite brand personally is the Skin Better Alto. I think it's a very stable, and in fact, they actually use THD, which is a vitamin C derived from a plant in Australia, and so it's
Hmm.
a lot more stable than the ascorbic acid. But I think a lot of times, even over the counter vitamin C's are so expensive. So I tell my patients, if you are going to splurge on a product, like
Yeah.
I'll cheapen out on I love a La Roche-Posay moisturizer. Okay.
Yeah.
I love a La Roche cleanser. There are things
Yeah.
that, yeah, we can get away with, but a vitamin C, I tell
Yeah,
them, I think,
you don't
yeah,
skimp on that. You
yeah,
don't skimp on your retinol,
yeah,
Yeah.
and you don't skimp on sunscreen.
yeah.
What are your thoughts on those that have an allergy to vitamin C, such as myself?
So you have a true allergy?
I don't know.
What happens?
I always
You eat
break.
oranges?
So
I
you
break
break out
out in these little
Is
tiny
it vitamin
bumps.
E? Do you pair it with vitamin E?
No.
Which vitamin C was it?
The vitamin C from Skin Better.
Oh, it's
okay.
Alto.
Yeah.
They do have, I think, 18 other antioxidants.
I
so it
just
could be
like I
something
just
in
get
there.
all these little tiny baby bumps.
Some people do have sensitivities. I
Yeah.
used to work with a
It can
provider.
happen. It can happen with any product. So there might be a small subset of patients who, develop an allergy to any given product. But in general, the molecules that are stabilized with other antioxidants, you also have to be careful about which ones you use for which skin types. Like some that have a vitamin E in it tend to be a lot more oily, can break people out. I break out from SkinCeutical CE ferulic like crazy. Like I start getting acne like the next day. It clogs my
I'm
pores.
gonna try Nora's vitamin C and I'll
Yeah.
get back
Hey.
to you.
Good stuff.
I love retinoids too for our patients with hyperpigmentation. I mean,
Yeah.
retinoids, I feel like across the board, anything, use a retinoid.
Liquid gold.
Yeah, liquid gold. But yeah, I mean, you're using these other ingredients. I think the retinoid, number one, helps the ingredients penetrate better, and then it's helping to increase that cellular turnover. So I think really it should be used in conjunction with a lot of these other topicals.
Yeah, another one, tranexamic acid, which I briefly mentioned, but it does come in a topical form too. I think works really well just in partnership with a lot of these other ones.
And you can take that one orally as well.
Yeah.
And I love the alpha and beta hydroxy acids. They help to brighten the skin, help exfoliation as well to help our melasma patients.
So those are going to be, your glycolic acid, your salicylic acid, lactic acid, those effective.
Yeah. And similarly, like, we use a lot of those acids for chemical peels. So I know you guys perform a lot of chemical peels. What are your favorites for, hyperpigmentation?
I love a TCA
Everybody
girly.
seems to love TCA pills.
Transchloroacetic acid.
That's calling for those.
Yeah, people love the TCA peels. They work really well. I think going back to what Dr. Zain had mentioned earlier, it's unfortunately it's not one peel and done. I mean, you got to think you're taking sometimes months or years of accumulated inflammation and sun damage, and so it is going to take time to correct that. But that being said, I do think patients start noticing results sometimes as quickly as the first peel. I tend to notice the second peel, I think, does a little bit better once we've gotten some of that like surface pigment. We're really able to like get into the skin and kind of bring that out and get it cleared. So typically we recommend anywhere from 3 to 6 for chemical peels. For glycolic peels or salicylic acid, which are going to be more of your superficial peels, I tend to use those more as like maintenance. So when I've kind of cleared someone up with our TCA peels, and maybe throughout the summer we're just doing a mild superficial peel to keep things at bay. But I think glycolics are great, but for my more moderate to severe hyperpigmentation patients, I don't tend to start there.
And it does still work even if you don't peel.
Yeah.
It drives me crazy.
Phone calls and
Yeah.
they're like, I'm not peeling. I don't think it's working. I'm like, it is.
It is.
It's working.
I know.
Mm,
I
trust
just
the
don't
process.
I almost don't even call salicylic and glycolic peels like peels anymore. I almost say like chemical treatments, because the perception is that I will be peeling, and if I'm not peeling, it's not working. And
Exactly.
They tend not to
Yeah.
peel.
And then we always start off conservative, especially for new patients, new to peels. You don't want to start off with a very high potency, concentrated chemical peel, because we don't know how your skin's going to react, right? So we want to take measured steps that are safe and effective, because the worst thing that can happen is you have a bad reaction with the peels too strong, leads to more hyperpigmentation.
Right.
And then you're in a worse position than when you first came.
Especially for skin of color, we often pre-treat with hydroquinone just
Yeah.
to help minimize that risk.
Definitely.
But there's a lot of people that are of color that don't think they can get chemical peels, and they can.
Mm-hmm.
Yeah.
Yeah.
I love chemical peels. I think they work really well. I will admit that, when I was a medical student, I would order them on Amazon.
He is no better than the people.
Well, I mean, I saw what my
No.
dermatologist did for me. I've looked at the bottle and I just Amazon.
Seller, like who's selling?
Who knows? But I've learned I learned from the mistakes. But yeah, skin of color can definitely benefit. All skin types can benefit from chemical peels, just with the right counseling and the right, precautions. You can get beautiful results with it.
Yeah, and I like pairing chemical peels. I like alternating treatments. I have found that alternating treatments has been one of the best things that people can do in regards to treatment. I think just having, like you said, different mechanisms of action working like synergistically to
Mm.
create the best outcome. I just find, like for example, the Laser MD, which is a laser that we offer for our melasma patients, which you might be thinking, wait a minute, you don't treat melasma with a laser,
Like,
but
that's a-
but that's why you do have specific lasers, like the Laser MD that doesn't have the same heat that some other lasers have, that is safe for all skin types. And again, we do start conservatively, with the amount of joules or the power that we're using on the laser and kind of increase each time. But I find that alternating with the chemical peels has been really effective.
I think in our last episode too, we kind of talked about the different types of hyperpigmentation. Specifically, what I'm trying to get at is like sunspots versus melasma. And yes, you can have both.
Mhm.
And I think that's super important. You do want to make sure you're going to somebody who knows the difference, because there is a great treatment for sunspots called IPL, it will worsen your melasma. So if you do have both, you want to make sure that you're getting the right treatment.
Yeah. And, also pigmented spots, they may be more than that. They might be skin cancer.
Oh, yeah.
Mhm.
And there have been multiple times I've heard of, oh, I went to this med spa and they were treating me with this laser and it just won't get better and it keeps getting
yeah.
bigger. And they've been treating like a melanoma
Yeah.
with
Yeah.
laser for years.
Yeah.
And yeah, I actually had a patient like who had literally a melanoma on her cheek. She's like, oh yeah, I went to the dermatologist or like the spa and I was getting it treated with a laser. And yeah, it ended up being a melanoma and huge case. Had to reconstruct her entire face, did a giant flap. And, goes to show you like, she was being seen at a med spa and, was treated inappropriately with a laser. So you have to be able to distinguish between, different types of lesions on the skin and, it can have fatal consequences.
Yeah, melanoma in situ it used to be called lentigo maligna. And so to kind of break that down, sunspots, the medical term is lentigynes. One single lentigyne is called a lentigo. So if you have lentigo maligna, that is pretty much melanoma. And so having that kind of spectrum of hyperpigmented spots or lesions really makes it very risky to go somewhere that may not know the
Mhm.
difference.
And we have seen those spots that like you ask yourself, what made you biopsy that? It
Mhm.
literally looks like a freckle, like a smeared freckle, like something that is not very, we always talk about the ugly duckling mole, but something that's very like incognito. So yeah, just to speak to that, I mean, it's not, your melanoma is not always going to be this classic black and red,
Yeah.
it's,
Yeah.
It's very scary.
some of the scarier ones are very discreet.
Yeah. But even some of the obvious ones, just in inexperienced hands,
Mhm.
like it's screaming melanoma and badness,
Mhm.
skin cancer,
Mhm.
and they're still treating it. Oh, la di da di da. I mean,
Because they
like
don't know.
they have
They
no
don't.
idea. I mean, you used to be a manager of a med spa. Like, how much formal training did some of these staff have?
She's
on
like,
skin-
don't get me started.
I know. I am like, don't get me started because again, they're just in a med spa. The focus really isn't skincare. If I'm being honest, the focus is all just making money and selling. So I mean, again, from a manager's perspective, I know firsthand that there's people that have come in and they're supposed to get training and they haven't got training, and I haven't been able to get the approval for somebody to
Mhm.
come in for training and they don't have that much knowledge. But we're just winging it,
Right.
just
That's scary. It's like the
I-
Wild West.
Yeah.
How often do you hear of those providers referring out to a dermatologist? Did it ever happen?
I have seen it. There are those people that are good about saying that, but then there are those people that are just like, no, we're
Yeah.
just gonna try this for
Yeah.
fun and see what happens, and then it goes left.
Yeah.
I think there's, especially in dermatology, there is not a fine line between medical and cosmetic for some places. And so I think a lot of med spas see skin as,
Cosmetic.
pampering and cosmetic. And
Yes.
it's not, unfortunately.
Yeah. And unfortunately, it has consequences,
Yeah.
and patients can get harmed. And
Mhm.
it makes me so angry. when I hear about these kind of cases that patients were mismanaged. Um,
I think that just over time I've learned, or my advice would be, if you think that something is off,
Mhm.
I wouldn't go directly to a med spa. I would definitely strongly consider going to a dermatologist, because you're going to get checked out
Yeah.
better.
You should be getting your skin checks
Yeah.
anyways yearly. And yeah, if there's something
I
concerning.
didn't even know anything about a skin check until I started getting into dermatology, so
Yeah, it's a different focus.
it is.
So, other, just to kind of piggyback on that too, with spots that are being treated that sometimes can look like other spots. So, we do offer IPL, I know, at our office too, for some of that, like post-inflammatory hyperpigmentation. Specifically recently, I've been using it for my lighter skin types, of course, who have more of like the post-inflammatory erythema for like
It
the
works really well for that.
post-acne. It's been working really well. Again, that's where you want to differentiate, the skin type, what type of pigment you're treating. But the IPL can treat the sunspots really well.
Yeah.
And it can also help treat some of the post-inflammatory erythema.
Yeah, but you have to be very careful with IPL and any of these laser technologies. They have heat and light, which are both potential triggers for melasma and hyperpigmentation. So you just have to be very mindful of that. Many of the lasers I do not recommend for my melasma patients, and some of my hyperpigmentation patients. It's just not appropriate based on their skin type and their condition. However, there are some technologies that are safe, but they have to be used in a safe manner. So that is also operator dependent. Knowing what energy settings to use, how many passes, how aggressive to go, how slowly to increment, the treatment options. So, I really do love the 1927 nanometer thulium lasers, the fractional non-ablative lasers, to gently kind of break up that pigment, try to help improve the hyperpigmentation either from melasma or other sources. And it works nicely, but you have to be patient. It takes longer because you don't want to crank it up, because you can actually worsen that melasma or hyperpigmentation.
That's what I was gonna say. You really want to trust your provider. Like, I know for a lot of these patients, it's incredibly frustrating. They want it gone like tomorrow. And,
Mhm.
a lot of the times I'll have patients come to me that want to start at like a deeper peel. I've never seen their skin, or maybe they're not pre-treating or things like that. And you really do want to do it the safe way, because again, you're gonna limit your the money being spent in the long run. You want to make sure that, you're not getting burnt or having any of these other complications that can happen. And so I know sometimes people tend to get, ready to go. They're like, well, I want this, give me
Yeah.
the strongest setting, or give me the strongest peel. And I'm like, whoa, 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 buddy, hold your horses. Let's do it the safe way. And that's where I think also, like, just getting into kind of like the aftercare, like taking pictures, is really important, because sometimes you're not able to really track that progress. When you're seeing yourself in the mirror every single day, it's hard to say, oh, I see a drastic difference, but pictures can really be very telling, and show you how much progress you've made.
Yeah, and it may take a long time to
Mhm.
see that progress. And you shouldn't be upset with your treating provider for taking it slow. They're doing it for your safety. I am conservative, and I like being conservative because I don't get into trouble that way. And I know how my patient's skin is reacting, and we're not causing more problems. My first priority is patient safety, do no harm. So that's really important.
I'd rather go to a provider that's going to tell me no, like I don't recommend that, and I'm not going to do that because they actually care. I mean,
Yeah.
it's pretty similar to, going to a hair salon and being like, well, hey, my hair is black, but I want to be platinum blonde overnight.
Yeah.
My hair's going to fall off if
Yeah.
somebody tries to do that,
Yeah.
and having that person be like, no, we're going to take our time
Yeah.
to get there. It's the same.
Yeah. Slow and steady.
Mhm.
Yeah.
Also, just avoiding some of these at-home treatments.
Whoops.
If I had a patient ask me recently, and like, this is not the first time I've heard this, but about like the lemon, like using lemons at home.
I've seen that people
The
use it like in
vitamins.
their hair to
Yeah.
get like
Like
Yeah.
natural highlights. I
yeah.
have
Yeah.
not seen anybody use it on their face.
Oh, I
Well,
had a
think about vitamin
patient-
C, right?
I guess so.
Yeah. Well, I had a patient.
Pure
she
vitamin
was
C.
A Hispanic lady, and she was asking for her mom. She said, she said her mom had used that. like, and still uses it. And I said, tell your mom to stop that. Buy
Well-
Oxy for mothers.
Well, there is a patient that I had who was doing this, and they went out in the sun.
Oh yeah.
And there is a rash called phytophotodermatitis where you're getting like this blistering, streaky, bouts of hyperpigmentation from a reaction due to one of the chemicals in citrus.
Mm.
So not cute.
It's such an interesting condition, and I would never wish it on anybody, but it's very fascinating to see. Like, I've even
Mhm.
seen somebody went to Mexico and had a lot of margaritas with limes,
Mhm.
and they had like fingerprints
Yeah.
on their legs from where they wiped off their fingers with that
Yeah.
vitamin C. So it can
And
make
I
a huge
love
difference.
making that diagnosis because to me it's like super
Nobody
I'm sick,
expects it.
and they're like, "Do you patient?
Margaritas.
Did you go on a cruise?"
It's like the light bulb goes
Yeah.
off and they're like, oh my, they think you're like the greatest person on earth.
Yeah.
So we've talked about topical treatments. We've talked about the oral tranexamic acid. We talked about energy-based devices and lasers. What other options do we have?
I think supplements like there's some multivitamins that can help improve the or even out the skin tone. I think glutathione is a huge one. So glutathione, we might have mentioned this before, but it's an antioxidant produced by your liver, and that helps to even out the skin tone. But as you get older, your liver produces less of it. So having that, whether it's an injection of glutathione or in an IV, can make a big difference. It doesn't really get absorbed very well if you take it orally, but I have heard that it some people do.
Maybe that's why they call them liver spots.
Yeah, maybe.
All right, Courtney. On that note, so we talked a lot about the types of hyperpigmentation and their causes. In this episode, we focused on prevention and treatment. I think that the biggest take-home points are, first, sun protection. I think that's huge, preventing the problem. And then also when you do have the hyperpigmentation, protecting your skin is huge. There are a variety of treatment options available, topical. You have your oral and your energy-based devices, and you have supplements to help out. And sometimes it requires combination therapy, and that's what I found the most success with. It's not one treatment that typically gets the best result. It is using multiple treatments together to really optimize the treatment. And it sometimes takes a long time. So I know that hyperpigmentation is frustrating, but seeing your board certified dermatologist and their team is really important so you can identify the cause and then the proper treatment so that you can get better soon. Okay. Well, hopefully you guys enjoyed this episode. Please like and subscribe. And until next time, Skinside
Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.